morning and welcome. This is Bishop Edgar Vann, and I am the host today for this critical conversation on our holistic health entitled Finding Peace Among the Pieces. And I'm so excited this morning to have such a distinguished and accomplished panel that's going to help us to get right into the bottom of all of our issues holistically. I have with me, of course, my right arm, my right hand, my partner for life, who is my co-host today, First Lady Sheila Vann. Won't you say good morning to us?
Good morning to everyone. Thank you so much for joining us, and we hope that this will be an enriching and helpful experience to you.
Well, thank you so much. First Lady is going to come later on in this symposium to field your questions. And so we'd love for you, if you have questions about mental health, physical health, emotional health, grief, whatever it may be, we're going to want you to put them in the comment box and join us as we interactively go through all of the things that are so necessary for our holistic health in this season. Now, I'm live this morning, Saturday morning, and I cannot help but mention the tragedy of George Floyd that has been going on in our nation, and the response that has taken place in cities throughout this nation. And we know all about that. That's not exactly what this particular symposium is about. I'm going to be coming on later live on Facebook, on Instagram, and I'm going to be speaking to it myself, but it does dovetail into all of the areas that we're going to be talking about on today. So listen, I'd like for you to share this with someone right now, tag somebody, neighbor, friend, whoever it may be. Let them know that for the next 30, 40 minutes, we're going to be dealing specifically with issues that affect all of us, most especially in this COVID-19 environment in which we live. And these are very, very troubling times for so many, for all of us. Life has changed, and many things will not go back. I think we might as well get used to that. We might as well understand that. And so I have a panel of experts who are here that are going to help me to help you to find help and hope in this season. And so I'm just really excited about this, and I want to introduce them. I just want to say that most of you know me as the 44-year pastor of Second Ebenezer Church in Detroit. But those of you that really know me know I do a whole lot more than that. And I've been involved in the community and medical health field for just about 20 years as an executive board member of Henry Ford Health Systems, very proudly. And I also chair the Community Health Leadership Council for Henry Ford Health System, which of course is a consortium of system administration, medical group, and other key stakeholders. And I'm very, very proud of that. I've been working in that area for a long, long time. And so my first guest that I want to introduce, I'm going to introduce our panel to you and have them to have an opportunity to initially give a brief statement themselves to help to introduce themselves. But I want to introduce Dr. KimberlyDawn Wisdom. She is the Senior Vice President of Community Health and Equity and Chief Wellness and Diversity Officer for the Henry Ford Health System. She's a nationally recognized medical professional. I remember in 2003 when Governor Jennifer Granholm made her the very first in the nation Surgeon General at the state level. I remember that, and she was not only the first, but the first African American and the first woman to actually take on a post like that on a state level. And so I'm very, very grateful to God to have her with us. I remember in 2012 when President Barack Obama pulled her in because of her expertise and put her on his community health advisory board. And she served there with distinction throughout those years of the Obama administration. Welcome, 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 Dr. KimberlyDawn Wisdom.
Thank you, Bishop. And thank you so much for this invitation. I am so delighted to be part of this effort hosted by you and First Lady. And I can't believe you have been pastoring for 44 years. You must have started when you were about 1.5.
I was in diapers. I was in diapers, you know.
But I just want to take a moment to hearken back to the days when you have always been so supportive of Henry Ford, of the community. You remember back in the 1990s when we were doing diabetes work together in your church on Saturday morning. So a Saturday morning event is not atypical for you or for us. And you were always so gracious, even helping me unload the van to pull the slides and everything for those diabetes self-management programs for African Americans. So that you're not new in this space. None of us are new in this space, but it's a new day. It's certainly a new day, and it calls upon us to behave in even an accelerated fashion. So I do want to start off by saying that we clearly realize that our health is our greatest wealth. And we also know that while wealth is not evenly distributed, neither is health. And one thing that's so important is that at Henry Ford Health System, and I've been part of the health system for 40 plus years. I as a medical student, I trained there, except for the time that I stepped away briefly to serve Governor Granholm and her administration. I've been part of the system in one form capacity or another as a practicing emergency medicine physician or as now one of the senior leaders. And I have to say, over those 40 or plus years, Henry Ford Health System has cared very deeply to take care of the needs of all people, whether they're affluent, independent of color, ethnicity, um, and we have taken care of the very affluent as well as the very under-resourced and the very underserved. And we embrace them. It's not something that we have taken on as because we have to. We have embraced our work around health disparities, addressing the needs of um, African Americans, Latinos, Arab Americans, people with disabilities, veterans, as well as those affected by those that are in the LGBTQ community as well. So I want to say we have been there for the long haul. But what's different about today is that while we have recognized health disparities exist, the committee actually that Bishop Vann chairs addresses health disparities. He was involved in the board 20 years ago when we were addressing health disparities. So this area is not new to us. But coronavirus has exposed, has illuminated, it shines a bright light that health disparities exist. So now there's no excuse for people saying, I didn't realize it existed. And because of that, it's important for us to identify ways to close that health disparities gap. So at Henry Ford, we've not said, oh, what are we going to do in response to COVID around health disparities? We have said, how can we accelerate the work that we've already started? Yes, we could do new and innovative things, but how can we accelerate what we've already been passionate about, put a lot of resources into, and have been very dedicated to address? So I just, as I'm getting ready to close my opening remarks, I do want to say that there's a quote from Martin Luther King that says, injustice, anywhere is injustice everywhere. And I think pandemic, let's translate that into pandemic terms. Pandemic anywhere, mind you, this is global. Pandemic anywhere or coronavirus anywhere is coronavirus everywhere. And also I want to say disparities anywhere is disparities everywhere. So we really have to now double down in ways that we didn't do before. So I would say at Henry Ford, we are open. We're not reopening because we've been open. We're actually widening our opening because even over the last 6 or 7 weeks, we have taken care of a lot of people affected by coronavirus. We've also taken care of a lot of people that were not affected by coronavirus. We've taken care of them safely. We've taken care of them competently with the highest quality. That has not changed. Now we are expanding our opening strategies. It's going to look a little different. People are going to have temperature checks when they come in. They're going to have symptom checks. You'll see people in gloves and masks. Sanitation is everywhere. You'll see elevators that are marked a little bit differently, where we're only going to allow a certain number of people in an elevator at a time. Our visitor policies have been adjusted. So just know that we are taking every precaution to make it a safe environment for you. But we have been open and we have been providing quality care during this entire pandemic, and we will continue. But we're also cognizant that we're treating a very diverse group of people, and we embrace treating that diverse group, and we will continue to do it with excellence, with commitment, and with partnerships that we can't do without.
Well, we thank you so much, Dr. Wisdom, for that opening statement. You know, you're a national voice. You've been on ABC Nightline and a lot of other national shows, and we're honored to have you and looking forward to the conversation. Well, you know, we know from a spiritual standpoint that we are trichotomous. In other words, we're mind, body, and spirit. And so the mind is so important. And it is, as we all know, a terrible thing to waste. We have Dr. Crystal Eason with us today, and I'm delighted to have her. She's a trailblazer in social work and in the counseling profession. She's been serving and counseling families and children and individuals for about 27 years. She has her PhD in counseling and, of course, has her own firm, the CLE, Strategic Solutions LLC, where she uses all of the gifts and all of the clinical certifications that she has in order to effectuate solutions for people with regard to mental health. This is an area that is so neglected along with the physical in our community. Welcome, Dr. Crystal Eason.
Good morning. Good morning. Thank you, Bishop. And I'm honored to be here this morning. I want to thank you and First Lady for having me. As you know, mental health has been one of my driving forces for many, many years. And I think this is a much essential needed conversation this morning, and particularly for our community, because that's an area that is often ignored in the African American community and other communities as well. So to have this discussion today, I think is vital, especially with COVID-19, but even prior to COVID-19, African Americans were 20% higher at obtaining mental health disorders due to all of the socioeconomic disparities that we experience anyway. So I'm just excited for the conversation, and I look forward to this time together.
Well, thank you so very much. You know, during this time, and especially during this pandemic situation, there has been, as you know, a lot of exacerbation of grief issues, emotional issues, issues that people have had with regard to closure with their loved ones, people experiencing with the high rate of death with COVID here in the Detroit area, experiencing death like never before, coming on them every day. I was losing friends and losing church members and what have you at a rapid pace that has never been, it's never been that way before. We have Dr. Karen Sheffield with us, Dr. Karen Gray-Sheffield with us, and I'm delighted to have her. She's been a facilitator for us for many, many years here with our grief seminars that we have here biannually here at Second Ebenezer Church. She's representing the Ascension system and the St. John system. And hey, we're all in this thing together. We're happy to have her, but she runs as corporate director there at Ascension, Michigan. She runs the Open Arms program. This is a program that I've highly recommended. I've sent people there. I've referred people to her excuse me, but I've referred a lot of people her way and given her a lot of work. But of course, the needs are so very great. And she also works, as Dr. Wisdom has also done, with infant mortality, that being one of the very difficult issues in our community as well. And so she's worked with families, and she's worked with grieving people, and really is an expert in our community for grief. She's also a licensed ordained minister and the pastor of the New Galilee Missionary Baptist Church on the east side of Detroit. I've been there many times, and I'm just so grateful to have Dr. Karen Gray-Sheffield with us today.
Thank you, Bishop Vann and First Lady, and all of these wonderful panelists who are here with us this morning. It's an honor to be a part of this panel. I have worked with many of you for a very long time. I know I've known Bishop Vann for over 20 years, and certainly Dr. Wisdom as well. I'm just excited to be addressing this issue because Ascension, Michigan is all about healing, which involves both the mind, the body, and the spirit. I'm blessed to work for a health system that integrates spirituality in all that we do, from our business meetings to our patient care. The other thing that I'm very proud of is that the work that we do is not just within the walls of the hospital. We have one of the largest community health departments in the country. We provide services to over 80 churches and other faith-based institutions. We have over 20 schools that have school-based health centers. And then, of course, the programs that I oversee, which is the bereavement services, as well as the infant mortality program. We know that death can come very early in the lives of our most vulnerable populations. The infant mortality rates in the African American community are triple that of other communities. And so when we're dealing with grief and loss, we really have to understand what's going on in our communities, in particular with the African American community, and what can we do to change that. I know during this pandemic, we realized that people are in need of special attention, and Ascension is all about dealing with the most vulnerable and those who have special needs. I think we invested probably $2 billion last year in community benefit work and providing free services so that people can address the needs. I know that we're all in this together, and I work very closely, as I said, with most of you on this panel. And we just have to continue to recognize the needs and what really contributes to complicated grief. And as you introduced this segment, Bishop, we have a grieving nation right now. When we talk about what's happened in deaths and what's been going on overnight in the last couple of days, I was witnessing a commentator on the news who literally broke down and started crying while she was talking about the death of that man. And so there is a lot of grief going on as a result, not only of this pandemic, but just the needs of our community, in particular the African American community. So I'm happy to be here this morning.
Well, we really appreciate you. We're going to get into that too, because the George Floyd situation, really, I think many of us almost feel as if he was a member of our family, you know, or that could be my son, or that could be my husband, or that could be my brother. And I think that there's been a sort of a vicarious grief that has taken place with that across this nation. And we're going to get into that as we come back to you in just a few minutes. I want to go back to Dr. Wisdom and talk a little bit about the COVID-19 crisis. Detroit, as you know, was a hot spot in the nation, right behind New York and in between New Orleans and a couple of other places as being a hot spot for this. And I really want you to, if you will, just describe the virus in as many layman terms as you can. Describe it. What has made this virus so different from other viruses? We've gone through SARS, we've gone through swine flu and H1N1 and a lot of other viruses. What makes this so different, and why was there such and is such a disparity and high rate of incidences of cases, the disease, and also deaths as it relates to this virus?
Great. Thank you, Bishop. I'll be glad to. So the coronavirus, you may have heard it being called COVID-D or the novel coronavirus, meaning new coronavirus. So while coronaviruses have existed for a long time, part of the common cold, this version or strain of the coronavirus is new. It's novel. It behaves very differently than many of the coronaviruses that we have seen in the past. As some of you may recall, back in 2003, of course, we've seen many pandemic type H1N1, Ebola, that sort of thing. But if you remember 2003 when SARS occurred, I was happening to serve as Surgeon General at the time in Lansing, and that virus is also a coronavirus, but that virus is very different than the coronavirus that we see now. And some of the reasons why it's so different is, for one, it's highly contagious. There are, I don't want to get into a lot of the scientific terminology, but we call it R naught. And R naught are ways of classifying the contagious nature of a condition or a virus. And this virus is extremely contagious. Oftentimes, the R naught value is 1, meaning that for every one person that is exposed to the virus or has the virus, they can infect one person, 1 for 1. This value for this coronavirus is 5.6, which means that for every person that's affected by the virus, one person that you're exposed to, that one person infected can infect 5.6 or between 5 and 6 other people. Those 5 or 6 other people then infect 5 or 6 more people. So you can see how this virus can spread exponentially very, very quickly. That's another part that's different about it. Also, another characteristic that's very different that we have to be very mindful right now is that ordinarily seasonal flu or many viruses, when the weather warms up, those viruses become ineffective, less virulent, which means the spread is less likely. In the instance with this novel coronavirus, there's not been any indication when we look globally, when we look at Australia and we look at other countries that have had this pandemic occur even in the warmer weather, there's not a clear indication that this virus will be mitigated or lessened or stopped when the weather warms up, which means that the virus could continue if we don't exercise the appropriate social distancing and masks and hand washing. If we don't exercise those behaviors very vigilantly, even though we see the numbers declining, which is great, we could see a resurgence of this virus, which would actually set us back quite significantly with all the measures that have been taken to mitigate the virus. If we see a resurgence, we will have lost a lot of ground. So we cannot allow that to happen. So that's another reason why the virus is different. And some people, there's been a myth. Some people have thought the virus doesn't affect African Americans. Totally erroneous. And that's why it's so important that we have websites that are trusted websites. We have them at Henry Ford. We have our Henry Ford Live Well website. We have our community health website that you'll be able to receive that information. So you've got to go to a trusted source, because having misinformation spread is just as serious as the virus spreading. So why has it affected, why is Henry Ford, or why is Detroit and Michigan, and why are we a hot spot? Well, largely we're a hot spot for several reasons. For one, the virus actually disproportionately impacts individuals that have chronic conditions. We know African Americans, people of color, are more predisposed to chronic conditions. So that's one reason. If you have a population that's more vulnerable, you're going to have, it's going to translate into more infection. However, I think the message a lot of people are not hearing is that, for one, this virus does not, well, in part, the historical underpinnings. Many people suffer from chronic diseases because of systematic practices and policies that have been in place for a long time that have actually marginalized or create challenges for communities of color to be as healthy. So we can't blame the victim. We have to also realize there are structures in place that have mitigated or have exacerbated some of this. Also, I want to mention there's another myth that we have to bust, and that is that affluent people, that coronavirus affects individuals that are under-resourced, individuals that are poor. That is erroneous. It affects all levels, and it affects them to the point where many very prominent people, very highly resourced, very affluent, have lost their lives due to coronavirus. So it's not a problem of people that are under-resourced only. So that gives just, I mean, I can share a lot more, but I want to be as succinct as possible because I want to hear from the other panelists as well. But that just gives a little snippet in terms of why it's different. But it's not just because people all have chronic diseases, you know, that are people of color in the city. There are systematic efforts that have gotten us to this place, which means we have to be very systematic in order to improve the conditions that people live in to avert
Find
a
out what
problem in the
the
future.
great. I'd love to find out what are the impacts and ramifications in these other two areas, in the mental area, and of course, as it relates to grief, when it comes to COVID. Dr. Eason?
Well, for one, currently I work for Development Centers, which is Community Mental Health, as their division director over all adult programs. So we service over 4,000 people there who already suffered with mild to moderate illnesses and persistent mentally ill issues. So for those families already, after COVID has triggered or increased their condition where they need more support, more medication. But for those who may not already be in the community mental health system, COVID-19 has been the onset for a lot of mood disorders, generalized anxiety disorders, depressive disorders, because of course, like Dr. Wisdom mentioned, this is something new. This pandemic has taken over many of the families in terms of their employment, family members dying. So it has triggered the mental capacity at levels that I don't believe we were prepared for. And in particularly, like Dr. Wisdom mentioned, our wealth, I mean, our physical health is wealth. I also say our mental health is wealth. And so we have taken it for granted, I believe, not necessarily intentional, but because we were not reared to address our mental health issues, and due to our trust issues as a community, this COVID-19 has now created the vulnerability in the space for us to have this discussion, and is welcomed at this time because people are now facing or are more open to deal with the things that have been governing their mindset during this time.
Right.
Great. The pain of grief, Dr. Sheffield, is so deep, especially in this hour. We're an emotional people. We automatically grieve very deeply. But this has brought some different ramifications to the grieving process. I want you to really talk about those stages of grief, but I also want you to address the grief response and how do we help give people hope in the COVID-19 environment?
Sure. This is so much rich information. We could actually spend 3 hours talking about, so many things: social determinants of health, disparity, just a lack of resources, and But when we look at grief and how it affects our communities, we do look at the 5 stages of grief. But we can also apply those 5 stages of grief to COVID-19, because the first stage is denial. And we know that many people denied this illness was even, going to affect their families, which exposed them much earlier. And we didn't really get a handle on reducing the spread of the illness. So denial is the first stage. The second is anger. Many people are very angry about what's happened to their loved one. They're angry because they haven't been able to go into the hospitals with their loved ones. They haven't been able to hold their loved one's hand. if their loved one is dying, they aren't even able to go in and to get what they feel is necessary information about what's happening because of their safety issues. And then the third is bargaining. We bargain with God, we bargain with our health systems, we bargain because we want to have more control over what's going on in our life. And we think that by bargaining, we can change the situation and the circumstances, but that does not happen. And then the fourth is depression. There's much depression within our communities, not just around COVID-19, but depression as relates to some of the disparities that people are experiencing. We talk about the deaths that have happened most recently, but also understanding that depression can be related to things other than bereavement. You have, loss of job, loss of your financial status, significant changes in your family, ending of relationships and, marriages, and many things can cause grief, and those things have to be addressed. Sometimes it's losing your physical mobility or your independence for older people who are losing their independence. And then for what we do in particular with Open Arms, we deal with a lot of trauma, and this COVID-19 is a traumatic loss because people don't expect their loved ones to go into the hospital and die as a result of what they perceive to be a flu. So it is very traumatic for them to go through this experience. And dealing with complicated grief and trauma related to grief can really make it even more overwhelming for them. And then finally, the fifth one is acceptance. And why acceptance is so important is because many people come to acceptance when they're able to have the customary burial services and the closure around those services. And they're not able to do that right now. They're not able to have funerals. They're not able to have memorials. So it's so much more difficult for them to come to acceptance, which is the fifth stage of grief. So there's so much I could talk about, but I know that we have much that we want to discuss, but grief is so important in what is going on right now.
Well, a lot of people have been losing faith, honestly, in this time. Of course, we look to displace and deflect, so they blame God as well. And they're trying to overcome anger as well, all in that same process. There are certainly children involved, and many times people don't have the correct answers or the right kind of way to talk to their children about the loss of a loved one. What do you suggest in that particular area?
Well, there's certainly the importance of talking to your children in a way that they understand what's going on. Many of the children are home now. Not only are they able to hear adult conversations, but they're trying to process this COVID-19 and have an understanding of what's going on. And what many parents do, even before COVID-19, they don't include their children in the grief process. They assume that their children are able to grieve on their own. They don't understand that children require counseling as well, that they need support groups as well. So at Open Arms, not only do we address adult grief, but we also are very much concerned about the grieving children in the family. And another thing is adults may process the grief faster, but children compartmentalize. It takes them a while to deal with grief. So they might need a little longer to process it. So they need more time. This is why we go actually into the schools and provide support groups in the schools for these students who are grieving so that they can deal with anger around grief. We talk about anger. We know that anger can really cause people to do things that they would not otherwise do. So helping them to develop coping skills, address their anger, address their anger at God. I know that you, Bishop, are very familiar with the book of Job. Job is an excellent lesson on how to deal with tremendous loss. And it also shows how God was accepting of Job's anger. I mean, he ranted and raved and talked about all of the reasons he should be angry, and God listened. God can handle our anger. God can handle what we're going through, and He knows that He's going to bring us through on the other side. So, those are the things we have to hold on to and understand. And just want to say one other thing as I listen to Dr. Wisdom and others, and we are all in this together. And oftentimes, people don't use the resources we have in our community. God gave many gifts to us. My gift is not your gift or Dr. Wisdom's gift, but those gifts are for us to benefit from. So if I need medical attention, I'm going to seek out a qualified physician that's going to be able to help me with that issue. The same way in terms of counseling. Yes, many people have their pastors. I'm a pastor, you as well. But I tell them, I can't do everything. We have to get grief support. We have to get medical attention. Yes, I'm going to trust God for the outcome. Yes, I'm going to pray about it. But I also trust God will send me to the right person that is gifted, that He is gifted and purpose for their healing. And so we have to all work together and provide all of our resources to help those who are in need.
That's wonderful. Dr. Wisdom, yeah. And then I want to come to Dr. Eason, because there's another piece of this that's really affecting us that I'd really like for you to address. Dr. Wisdom?
Great. I'm just going to say really quickly how I'm so excited to be on the panel with these two very distinguished presenters and professionals as well, because when you talk about grief and when you talk about mental illness and when you talk about the children, we know from a scientific standpoint, there's a whole effort called ACEs, Adverse Childhood Experiences, and that's toxic trauma. Our children are experiencing toxic trauma right now, going through this COVID experience. Why it's so critical for now to address it, but also it will have implications in the future, because many of the chronic diseases that adults experience are due in substance use disorder and that sort of thing are due to traumatic experiences that they had as children. So this has generational impact. And that's why we have to pay very, very deliberate attention to what these two professionals are talking about, because we're not talking about just getting through the day, the year, another few years. We're talking about the next generation as well.
Absolutely. And while we're on talking about the family, Dr. Eason, I really want you to address, because my understanding is that domestic violence and child abuse and these kinds of factors are also dramatically increasing during this time.
Yes, they're dramatically increasing for several reasons. I want to go back to Dr. Karen just for a moment, because you brought up the book of Job, and being a member of Second Ebenezer for many years, I want to address the spiritual implications of mental health. And so many people believe that if you have a mental health issue, it's considered a spiritual or moral weakness. And so although you mentioned clearly, we know that there is implications for spiritual healing also. There are those in the family, and the Black family in particularly, who do not believe that. They believe it's a demon. They believe that it doesn't exist. And so I think in order for us to move forward with this, to provide the hope, we have to distill the myths, and we also have to distill our perception of mental health. So these things are increasing because no one believes a lot of times that help is available besides church. Now, I understand that God is the author and the finisher of all things, but the mental capacity of people believe that besides church, there's nothing else that I need to do, which has been a barrier for generations to come. And so to address these issues, we have to make them understand that, yes, God is almighty, but we know that the doctor gives a pill for hypertension, but also the clinician gives a treatment methodology to help you deal with your mental strongholds or your mental illness. And so with the agency that I currently work for, we provide therapy daily, but the violence is increasing because we have not dealt with the unresolved ACEs that Dr. Wisdom spoke about, where the adults haven't dealt with their childhood trauma. Therefore, when it comes into COVID-19, it exacerbates because it's been unresolved. And so we have to make sure that we allow our families or create a safe haven for them to go seek the help that's available.
Well, that's really, really good. I mean, that really gives us this holistic look, and this is what my goal was today, is for people to see the various areas and components of their health, and to know that all of them actually work symbiotically. They all work together, and along with the spiritual side of this. You know, when my car is broke down, I don't sit next to a flat tire and start praying. I take it to the shop to a specialist who knows how to fix a tire. Now, I don't know how to fix a tire, but I do know that I can go where to go when I need it, so that car can be fixed, so that tire can be fixed. And I think that sometimes we have some traditional ideas of spirituality that we know are unfounded. In other words,
Right.
we know that they are not even really practical. If I go to the foot doctor, if I go to the eye doctor, if I go to my primary care physician, and they specialize in different things, then I need to go also and to check out to make sure that there are not any mental issues. Now, there's still demons, there's still spiritual issues, but we've got to know how to distinguish between the two. And I think this
And
is
there
where
is a distinction.
there is a distinction, and that's where all of this really goes. I want to go a little bit proactive, and then we're going to take a short break. I want those of you who are out there, listen, this is needful and meaningful information. This is, I'm telling you, and you're getting it for free. I mean, this is really, really a great symposium today, a holistic look at finding peace among the pieces. And so we're going to allow you that opportunity now to share this, to tell somebody about it. We've still got a little ways to go here with all of these professionals, Dr. Wisdom, Dr. Eason, and Dr. Sheffield, helping to address the holistic areas of the physical, the mental, and the emotional, and most especially in the times in which we live. You know, I want to get a little bit into the George Floyd piece a little bit, because it's right there where we are today, and there are all kinds of ramifications behind this. And I'm not going to get into the political part, not on this forum. I'm not going to get into some of that, but there are this holistic piece here, the medical, the physical, and the emotional, and the mental are all involved in how we as a nation and we as a people view this particular time. So I want to ask our audience out there, First Lady's my co-host. She's going to be fielding your questions, and I know that you've been sending them in, and she's getting them, and she's going to get ready to share a few of them with us before we go off. But we're going to continue this conversation. It's a meaningful conversation. And I really like positive, proactive conversation. You know, I see enough conflict out here. I see people just trying to stir up controversy instead of trying to help people, instead of trying to bring hope to people. I'm a hope dealer. I like to bring hope to the community. I like to bring hope to our people. I like to bring hope. I want there to be a vision of a preferred future, a preferred reality for all of our people. I wish above all things that they would prosper and be in good health, even as their soul prospereth. That's the trichotomy that we're talking about today. That is the balance there. that we're talking about today as well. I know a whole lot of people that work out, you know, every day for an hour and a half, 2 hours, whatever. They're sweating all on Facebook, but they have confusion in their minds. I know people that diet. They're in they're the right weight for their age and height and all of that kind of stuff, but they crumble in a crisis. They're not in a position to deal with life, and there is a balance to life. There's a holistic balance to life that we're promoting today. We want to go back and talk with all of these professionals about what do they think proactively that we need to do in their various disciplines with regard to achieving hope, achieving resilience, achieving a place of stability, and not just stability, not just surviving, but thriving. That has been my mantra for the last a couple of years here at Second Ebenezer. Actually, our motto for this 80th year, this is our 80th year celebration, has been Thrive. It's a journey we will win. And I want people to win this journey. I want you who are out there to win this journey. I want you. And that's why I want you to share this with someone. You just might help somebody crawl out of a dark place that they've been in, whether it's physical, whether it's mental, or whether it's emotional. And so I want to get back with our panelists right now. And I want to talk a little bit with them and send your questions in, please. We're going to be taking some of those at the end. But I would like to get to some proactive strategies. Dr. Wisdom, you tell us, what do we need to do? We're African Americans susceptible to these comorbidities, these chronic conditions. We're susceptible to all kinds of diseases. They exacerbate in us because of all kinds, because of poverty, because of the food desert situation, because of unhealthy eating habits, et cetera, et cetera, et cetera. You're one of the greatest physicians I know. Tell us, what do we need to do?
Well, a couple of things. For one, there are many programs that are available to community members that are free of charge. And many of them are undersubscribed, meaning that people may not avail themselves of those various resources. So on our community health website at henryford.com/communityhealth or henryford.com livewell, we have many resources. So make those resources, utilize them. We design a lot of programs. We work with Reverend Sheffield around infant mortality and Ascension and other DMC and other health systems and healthcare entities across the region. So we have infant mortality group visit programs. Of course, we're not meeting in person, we're meeting virtually, but some of our programs are not subscribed. We deliver food. We have food delivery programs. We have cooking demonstrations. We give people free groceries to replicate recipes that we've made, that we've shared with them. So I would say take full advantage of all these health and wellness efforts would be one huge way to find hope and be responsive, because those resources are there. And also when we have sessions where we invite you to, we want to hear from you, participate. We want to hear your voice, because we want to tailor our programs to meet your need. We're not doing these things for our own benefit. We're doing them because we want to meet your needs. We have community health workers, who are those people in the community that are deep in the community, but they're employed by Henry Ford Health System, and they function as that liaison. They're always there to help you identify how to address social needs, whether it's food, housing, transportation, education, violence prevention. We are there to help you. So respond, reach out to us. That's one major way. One last thing I do want to say is that with a partnership with the Neighborhood Service Organization, Linda Little is the CEO. Many of us have partnered, Ascension and Henry Ford and Chas Clinic in Southwest Detroit and DMC and others. We have COTS, we have partnered to open up a recuperative housing center where people that are in the hospital or in the ED that may not have a safe place to go for 2 weeks, we have accommodations to put you up in a beautiful place, 3 meals a day, laundry service, a lot of TLC to help you navigate through a 2-week period where it may be unstable. Maybe a mom delivered and can't go back home because there are COVID affected people in the household. So whatever that situation may be, we have developed, and this is all since COVID. This is a COVID response. So we're saying, if you need those kind of resources and need that kind of help, reach out to us because we have the facilities, we have the resources, but we have to have you respond.
You mean a hospital does all of that?
Well,
That's amazing.
With a lot of partners, you know, Wright Lassiter, our CEO, is very supportive of partnerships. So whether it's public-private partnerships, we work closely with the city of Detroit, or faith-based partnerships, we have faith community nurses. We have a lot of partners. We can't do it without our partners. We partner with Ascension, even in this recuperative housing initiative and NSO. So we can't do it without partners, but we can certainly initiate it and say that show where there's the need. And then our partners are the ones that work with us to help close the gaps together.
Well, that's just great. And the leadership of Wright Lassiter III here in Detroit is just not even yet come to its apex.
Exactly.
For the kind of leader and man that he is. But I'm hoping that on the bottom of the screen, as you were speaking during this particular segment, information that you are giving to our audience today is there. I want to encourage everybody to make sure that you're taking advantage of the information that's at the bottom, the lower third of your screen. There's all kinds of contact information for the programs that you're hearing about. Dr. Sheffield, would you tell us what are some of the proactive things that can be done for our emotional health, especially as it relates to grief? What are the coping mechanisms? What are some of the things that we can do? And I know our families are going to have to stay connected and stay together. I know that's one of the issues, but can you just give us some proactive tips in that area?
Sure. First of all, I want to say I appreciate you calling me doctor. I'm unfortunately not a doctor or PhD, but certainly
Been prophetic. That's all. That's
a professional counselor. I thank you for acknowledging my wisdom in this area. But I want to just say this real quick, that we have to address fear and anxiety. In this particular time and in general, when we're talking about grief and loss, fear and anxiety can paralyze us, can keep us from moving forward and addressing some of the things that are going on in our life. I know Dr. Wisdom spoke about the ACE research that has been done, which is adverse childhood experiences and that impact that it has later on life. But in that research, in that study, they found that resilience can change and alter the outcome health-wise, mentally as well, if you are involved in resources or people that can encourage you. And this is what we all want to do in the work that we do. We want to be an encouragement. Our teachers can encourage, our pastors encourage, our health systems, of course, educate and encourage. And if you have somebody in your life that can be an encouragement to you, that can give you additional resources, knowledge, or support, that's going to change the outcome for you and your life. I think that when we talk about grief and bereavement, we all are going to experience grief and bereavement. That is just a part of life. But we have to really be careful about complicated grief. Grief where you're not able to do the normal things, it's debilitating you. And that's why we need mental health professionals like Dr. Eason to get involved and to bring you out of this complicated, when you're in a complicated grief situation, oftentimes you're thinking about taking your own life. You can be suicidal. You can say, I want to be with the person that I've lost. I'm giving up. I've lost all hope. You don't believe that anybody can change your circumstance or your situation. And so we have to be available, regardless of what title we have or what role we play. Any type of encouragement has been proven to change and to help people to know that there is hope. And I think about Isaiah 43:1. It tells us, don't fear, for I have redeemed you, I've called you, you are mine. And so we have to really look at in ways that we can provide hope for the future for our children and for our adults who are going through these traumatic and difficult times.
That's great. Dr. Eason, what are some of the things in terms of mental health? Well, how can a person maintain their sense of strength in their mental health, and then being proactive and not just waiting until there is a crisis, not just waiting until there is something traumatic and overwhelming, but how do we do this, each and every one of us, each and every day?
Well, first, I have a saying that says, where there is healing, there is hope. And when there is hope, there is healing. And I think we have to first be very clear about what mental health is. And so, first of all, it can be a condition that impacts your thinking, your mood, and your behavior. So when you understand your behavior as what's considered normal, and then you discover that my normality has changed and I'm no longer productive consistently, then there's an issue. So in order to address it, you first have to make the decision and be okay with I'm struggling, or be okay with I'm suffering, because a lot of times in our community, we're not okay with that. And so we won't make that decision to get help. So first understand that it's okay and that help is available. At my organization, we have ACT, assertive community treatment, where people will come to your home and you won't have to go through the red tape of trying to get support. So knowing that first, I'm making a decision, I'm empowering myself. What's that? Encourage thyself to maintain my mental stability and not take it for granted. So daily, positive affirmations, positive self-talk, and remembering that when God has brought you through something before, he'll do it again. And so that resilience factor is key, and understanding that it can happen, but you have to be your own cheerleader, because I can encourage you, but if you're not in a place where you encourage yourself, it's just simply not going to work. So you partner with someone, you trust, because communicating is therapeutic. So we first have to be willing to share our struggle, share our issues, share our pain, and then connect to the external resources that's available. So there's walk-in clinics, BCA Stonecrest. One of our members is the lead of admissions. There's a 24-hour walk-in, there's 800 numbers, but you first have to make that decision so that you can reach these external resources. And so it's okay. We all have suffered. The Bible says after you suffer a little while, he will restore us. So we just have to accept the suffering that comes with the celebration also, but then understand that I must be the cheerleader so that I can heal. And that's a daily practice that we take for granted. We get up, we eat well, we exercise, but we don't say, you know what, I have an anger problem or I'm depressed. Let me find out about depression. Let me read about my anger so that I can even know my triggers so that I can maintain my stability. So we got to know who we are in that area, our mental capacity as to what we can consume and not consume. And so I tell people, turn off the TV, turn off social media, because you don't have the capacity to digest what's happening in the world. And so it contributes to your mental health state. And so we have to do some basic things every day to protect our mindset. And then looking at your thinking process, what's on your mind constantly? How do you restructure what you think about? Because a lot of times it's our thinking that's causing us to suffer. So we have to take a look at that. And I can go on and on and on and on, but those are some very practical things that we have to do daily. And of course, think on these things. There are some things that have happened to us that is good. And we have to remember what's good, what's honest, what's truthful, because we will forget that in the middle of a catastrophe. But there's still something good that we can think about in this process. Look, I get all excited.
Wow, wow, wow. Well,
Is she
I
there?
guess I didn't reveal it in the beginning, but I guess now you know that Dr. Eason is one of my ministers here at Second.
Okay. I was gonna say if she
Same
wasn't, she
thing, right?
yeah, if she wasn't, she needed to be.
Right, right.
I was gonna vote. I was gonna
Now,
vote her in.
what I admire about all of you is that all of you are women of faith, number one, but all of you have a multiplicity of gifts and graces. And so that's just so important in terms of your ability and capacity and relativity to people and the people that you serve. Well, we're going to be getting the questions from our audience in just a moment. I'm going to ask all of you this last question. It's sort of a universal question, but I want to make sure that everybody out there is seeing at the bottom of the screen all of the information, all of the resources that we are sharing with you on today. You've heard a lot about what you can avail yourself of, what you can use to help you find a place of hope in whatever season of life you're in, and whatever's going on in the world, and whatever you and your family are facing. It's just good to know that you're not in this thing by yourself. There are resources there. There are people who can help you. There are things that are in place and structures and systems in place that are designed to meet your need, and they're available. You just have to avail yourself of it. And the only way you can do that is to be aware of it. The Bible says, of course, that it is that lack of knowledge that paralyzes us. And we're destroyed literally because of the lack of knowledge. I don't want you to be without the knowledge that you need in this season, without the resources that you need in this season, without the things that are available to you in this season. So make sure that you're taking those numbers down, or those emails down, or those websites down, whatever information you see at the bottom of the screen, to be a part of it. And listen, I haven't asked for a lot of likes and a lot of hearts and all that, but I wish you do it, because it really does help to encourage our panelists to know that this has been a significant opportunity for them to facilitate our community on holistic community health. Well, I want to ask them one last big question, and it is a question that all of them can answer from their own perspectives. And then my co-host, First Lady Vann, is going to help me with the questions that are coming from you, our audience. She's been waiting in the wings and getting ready and getting all those questions together for us. We're going to have a few of them that we're going to have our panelists answer. But I want them to try to deal with this particular question first. The future will not resemble the past. And normal, generally speaking, is behind us. We go and forge now into a new future because of this COVID-19 and because of other things that are going on in our world. We forge into a new future, yes, with faith, but also in the various disciplines that you all represent. There's going to be new things and new normals and new realities. And my assessment is that there are some things that will never return. There are some things that the paradigm has already shifted. And we're going to have to be ready to accept and adjust to some new things medically, some new things mentally, and some new things emotionally. What are your thoughts about that? I'll start with Dr. Wisdom, and we'll go to Dr. Eason, and Dr. Sheffield. We'll close out there so that we can really receive your words to this audience about what we may be facing and how we ought to face it in your various disciplines. Dr. Wisdom.
Sure. There's no question that there will be a new normal. And it's important for us to embrace the new normal, because in some instances, the previous normal wasn't altogether lovely
That's right.
for many individuals. I mean, when, as Dr. Eason and Reverend Sheffield have alluded to, our infant mortality rate is appallingly high, worse than developing countries. I mean, it's shamefully high for a country of our status to see our infants die in the city of Detroit. Between 150 to 200 babies die on average per year. So if that was the old normal, I want a new normal in that respect. So I'm thinking we need to embrace a new normal, look for a new day, a much better day. So, Rahm Emanuel has been quoted as saying, "Never let a crisis go to waste." And I think Bishop Vann might have heard me say that at some of our board meeting calls, and I didn't mean to be insensitive, but it's like, if we don't redeem this time in such a way that we look back and say, that was not so good, we're much better off now, than we have missed an opportunity. So I'm embracing a new normal, and I'm, waking up every day looking for how the new day can be much better, particularly as we think about, vulnerable populations and communities of color, and um, people that are affected by disabilities, veterans. When I talk about diversity, I talk about not just racial and ethnic, but a broader group. I think part of a new normal too is we're going to be seeing virtual visits a lot more. So Henry Ford Health System, like I said, we've been open. We've never closed. We have gone from 150 virtual visits a week, meaning telemedicine, meaning we call you on your phone and we look at you and we have your appointment that way, to over 10,000 per week. So I would say the new normal may in some ways be better. However, there are always unintended consequences when we introduce something new. Not everybody has broadband. Not everybody has access to the technology. The technology isn't always working well. In some communities, so it does help for people that may not have transportation, that sort of thing. But there are also, you can't pick up cues as a physician when you're talking with someone on the phone. You can't pick up things that you might pick up when they're in the office. So we always, while we embrace the new normal around virtual visits, which is where we've been trying to go for a long time, we also need to be cognizant of the fact that that doesn't work for everyone, and that maybe we need to do more home visits. And we do home visits already. Our community health workers do home visits, had done them all the time. So maybe we need to accelerate our home visiting process. So basically I'm saying we need to look for a new normal, and in a way that it's a better normal. And in closing, while I mentioned very much that we are opening wider at Henry Ford and embrace people coming back in full operation, we also we have to be open in order to close gaps. So we certainly don't want people of color or vulnerable populations not to come in because they're fearful in any way. We are here for you. People are suffering from heart attacks at home. People are having strokes at home. We have the best technology, and yet people are dying at home because they're fearful. So I'm saying we're open. So we don't want those gaps of deaths around stroke and heart disease and to increase, and the gap to widen because people are fearful about coming in. Come in. We'll take great care of you. We have the best technology, the best medicine. I know we've got others on the on the panel who have stellar physicians as well. So we all work together in many ways, but we are open and we have the best for you, and we don't want you to miss an opportunity of not coming in because you're afraid of what may be there. We are well prepared, and we need to be open so we can close those gaps.
Well, thank you, Dr. Wisdom. Dr. Eason, give us your thoughts about people being able to cope and to adjust to the new reality. Of course, change comes very quickly. People are very incremental. I always say that people are for change as long as nothing changes. So you tell us, from a mental health standpoint, how do we face that future?
Well, I think too, like Dr. Wisdom mentioned, this is a new normal. that we are adjusting to, and there will be some aftermath as it relates to mental illness. But I think if we can focus on some of the good that has occurred, not necessarily minimizing all of the trauma and the grief, but I think our mental health status has been exposed during this pandemic. So after, just understanding that if you are experiencing some sadness, some depression to the place where it's become debilitating in your daily functioning, that there is help available and that you can get through that red tape, and it's absolutely okay, because that's why it exists. And expect, and particularly if you have personally suffered as COVID-19 hit our country, that there will be some sleepless nights and anxiety, and is expected. However, experiencing some anxiety, experiencing some depression does not mean that you have to live that way always. And so to just admit the struggle, because there will be some aftermath, but because we're resilient, because we do believe in God and we do know what our tools are, then we have to use our tools. Sometimes we forget the tools that we have, and we have to use them. The place I used to work at, we say crisis is an opportunity to change. And there's some good things that have happened as a result of this. I know we all have been health conscious. I ain't never took so many vitamins in my life. So there are things that have happened that can help carry us through this aftermath. And I think we have to be very intentional about what those things are, even documenting those things. You have to write down what's your weak area, what's your strength area, so that you can devise a plan for your mental health, just as you would a financial plan or a physical health plan. What is your plan? What do you need to put in place to maintain your mental health? Because we can see that we are one crisis away from experiencing some insanity. So we can no longer take that for granted. And so we have to create our plan, and it's very personalized, and then get some help with it. It's available. So I think we just, Bishop, need to be real intentional about how do we maintain our mental stability, the people we talk to, the stuff we listen to. These are very basic things that we can take control of. And detoxing. There are times where you have to say, you know what, I'm going to go on this physical detox, a fast, but I need to do a mental detox, because we consume so much sometimes, and we don't realize how it's impacting us mentally. So we have to detox and let go of some stuff we've been listening to, and that has to become a daily practice, and not just when something happens, but it has to become a daily practice.
Great, 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 great.
So,
well, Reverend Sheffield, I really want to get your perspective on all of this before we go into our other questions.
Okay. And everything that's been said is so important. I think that when we think about how we've basically been training ourselves to be safe, it's caused us to isolate from the support systems that we've had in the past. So the things that we used to depend on, like our church or relationships at the church, like going to the hospital or feeling safe to go into the emergency rooms, that has really caused us to, again, isolate more. And we don't want to isolate ourselves from all things, but we just want to be careful in how we move forward. Everything is going to change. You know, things that we used to do, we won't be able to do in the same way. We work with, you mentioned domestic violence, and we work with domestic violence victims. Some of our crime victim advocates have been, even now, because of the isolation, having to go to the homes and have police officers present personal protection orders so that these women can be safe and come out of that isolation so that they can be in safe places and being helped in ways that they probably would not have been helped in the past because of what's going on. But we have to really be open-minded. We have to try new things. I talked to many of my own members and people who have lost loved ones to COVID-19, and they're grieving, and they want to know, how can I come to closure and acceptance with this death? And sometimes we have to do new rituals, personal rituals. We have to do things at home to memorialize that person. We teach people people about memory boxes and taking things, placing them in those memory boxes, revisiting them when you're feeling overwhelmed by emotions. And then, of course, when we're talking, as Dr. Wisdom said, we will be providing opportunities for group conversations, like I'm sure you do as well, Bishop. Even when we're doing our Bible study, it's now done very different than what we were able to do before. So embracing those new ways of doing things. And biblically, it teaches us that sometimes we have to let go of the past. I talk to my domestic violence victims in the same way. You got to let go of the past to move forward into the new. And again, I think about Isaiah 43:19. It says, behold, I'm about to do something new. And now it shall spring forth, and you shall not know it. But he says, I will make a way in the wilderness and paths in the desert. So we have to understand that even when we're in this desert situation, even when we're in what we perceive to be a wilderness situation, it might be because we're being taken to something new that's going to help us to move to, something that is going to be even more positive for us. So embrace the differences, embrace opening yourself up to new ways of doing things and accepting resources that are really going to take you to a next step, or sometimes to a better place and situation as relates to some of our domestic violence victims.
Well, all of this has been so wonderful. It's been so great. And we've had a chance to really dig deep into a lot of these issues. And it's just been wonderful. I truly want to thank each of you for agreeing to be on this panel and to be a part of this symposium of finding peace among the pieces. I just want to say to the audience as we continue, I want you to share this with someone, put it on your page, whatever you need to do, because people need this information. We've had a lot of information in the lower third of the screen for you that's available, resources that are available. It's amazing what I've heard here today, the kinds of resources that are available. Things that you thought were not available from a health system or from a facilitator or from a professional, and the referrals that they're able to make for you and your family during times of crisis in your life. It's just wonderful. And so please avail yourselves of this. And certainly if this has been of great benefit to you in any kind of way, or a blessing to you and yours, as you've watched this, please let somebody know. Let us know. We'd like to know. We'd like to know as we want to do something like this again, whether or not it is something that you will appreciate. Well, listen, I have the First Lady of Second Ebenezer with me, and I'm grateful that she's gotten right back on. She wasn't really off, but she was kind of in the background, and then now bringing her to the forefront to bring some of the questions that have come from you, our audience. First Lady?
Thank you, Bishop. Thank you for doing this. I'm telling you, and ladies, this has been so very helpful and so much needed. I'm seeing the questions that are coming in. They're coming in like rapid fire, and people are really afraid and they don't know what to do. And so I've been trying to put together some of these because we have so many questions here. One comes from Sonora Cannon, and she wants to know why there's so many false negatives when it comes to the test.
Sure, I will be glad. Yeah, I'll be glad to take that one. So in terms of, there are many different types of tests out there right now, and some are more reliable, meaning they have a higher specificity and sensitivity when we think about false negative and false positive. So the challenge around some of the testing is some of the more rapid tests are not as sensitive and specific, so they're not as reliable. The more reliable one, or the more definitive one, is what we call the PCR, polymerase chain reaction. I'm sorry, I should have gone medical. Okay. But the PCR test is the one that is more definitive, but the turnaround time is much longer. Sometimes it takes 2 or 3 days to get that test back. So there's variability in the types of tests, and that's why perhaps you're seeing some tests that are that the results may not be as reliable. So, you know, we have. I would combine a test with seeing a professional at some level, you know, a healthcare provider, and there are many available. Yeah, I think even in our system, the CHAS Clinic in Southwest Detroit, we're not, it's not based on insurance status or even documentation status for that matter. So combining the test result with conversation with a provider, because if they do one test that suggests something, or maybe is a, you know, a negative test, there are other more definitive tests that can be done, especially if you're looking for reassurance that you don't have the virus. And especially now that we know that some people can be shedding the virus and they're still asymptomatic, no symptoms, yet they're shedding the virus. So, and especially as I explained, it's so contagious. So I would link the test result with a conversation with a provider in terms of how to interpret that and then how to govern yourself. But I think what's even most important, what you're not exposed to, you can't contract. Okay, it's a contagious thing. You can't contract coronavirus if you're in a, you know, far removed from someone, because it's just not possible. So if you can still practice that social distancing, wearing a mask, presume that you're positive and presume everyone else around you is positive. Just assume that. If you assume that and practice that way, then you're protecting yourself, you're protecting other people. Hand washing and social distancing. I can't emphasize that enough. That's how we've been able to flatten the curve in our state and in different places around the country. We have to practice. So a lot of the onus or the burden is within the hands of individuals and how they practice, as well as getting testing. And lastly, I want to say, and this should be a resource that's available, initially the testing was restricted to people who were very symptomatic and very ill. So people say, I'm hearing mixed messages, and that's why it's important to go to our website. Initially, we didn't have many tests available, so we had to restrict the test to those that we knew were going to be hospitalized. So even if you came to the emergency department and you had some symptoms, but you were not sick enough to be hospitalized, we would not test you. It was not any kind of discriminatory behavior. It was a practice that we had to engage in because we just did not have enough tests. So if you were sick enough to be admitted, you got tested, which of course you were pretty sick. So, but now with the governor's work, we have over 250 sites around the state. You can go on one of those resources or look for Test Finder, COVID-19 Test Finder, and you can put in your zip code and you can find out where a testing facility is, where it exists near you. Also, the Mayor Doug, and it just came out a few days ago now, he has in place where free testing everywhere, anybody, it's because we have more tests available. And so there's no restrictions. So if you're fearful, if you wonder, you can be tested, even if you don't have a car or a prescription or a doctor, which was the case early on, you can still get tested. If you don't have a vehicle to get there, they'll even pay a $2 for you, $2 to get to the site. So testing right now, and then combined with a conversation with a healthcare professional. But if you can, just practice as if everybody's positive, including yourself, and we can mitigate this coronavirus.
Thank you very much. I've been told that I got a short amount of time here, so we're going to try to see what we can get in. First Lady, thank you.
Okay, now Lisa Joy Stewart wants to know, how do I keep moving when your loved one is still hospitalized and fighting COVID-19? When you feel stuck, what do? How do you handle feeling guilty and hopeless when you can't be with your loved one?
Wow. Reverend Sheffield.
Well, again, we have to really find the resources, and there are many resources in our community. I know that our number has been on the bottom lower half. You can certainly call our office anytime. We have individuals here that will talk to you, will walk you through the process, will help you to develop coping skills. That's what we do. So I certainly encourage you to reach out. don't do this alone. There are people that are able to help you and to talk with you and to encourage you, because this is very much overwhelming for many of the people who are experiencing this COVID-19 and not able to communicate with their loved ones in the hospital or other places. So certainly call the resources, call our number. We will provide the resources and support that you need.
Dr. Eason, would you address that as well, Dr. Eason?
Yes, I think too, one of the things that is happening is really, if you have a loved one that's sick or a loved one that's passed, it's the survivor's guilt that is stifling. And so psychologically, I think also knowing that you have to fight for your life so you can fight for your loved one. So psychologically, not allowing the guilt to overtake you because it's not your fault. And so it's the things that you say to yourself. So mentally, it's just another way to fight for your stability so that you can fight for your loved one. And so we call that survivor's guilt, is why you have that pressure of guilt. And I would say release that the best that you can, but take advantage of all of the resources, but also do that mental work daily so that you can have the capacity to fight for your loved one as they're sick in the hospital.
Okay.
Can I just chime in very quickly? Another thing, when people are in the hospital and you don't have the ability to visit them because of their COVID status, it's what I really encourage people to do, and it's not done systematically across the entire enterprise, but to ask the healthcare professional that you're working with to do a FaceTime visit.
Yeah.
And that's what started that probably 8 weeks ago when this started just emerging. So while we're maybe down the road, we could put something in place to have it more systematic. But the healthcare professionals, they'll use their phone and they could do a FaceTime visit. And that's what I've encouraged, because people those family members need to connect, and they need to resolve, and they need to go through their stages of grief. And the technology is there. It's a matter of, and many of the docs that I've talked to, they have been so gracious when I'm navigating for families to do that FaceTime visit with family members so they can connect.
Thank
so
you.
It's keeping everybody safe and whole.
Great.
Bishop, I'm trying, and the answers that just came through answered a lot of questions, because a lot of people are just fearful about their loved ones, can't see them. They're stressed out about it. Darlene Lucas is saying, I'm afraid to see my children or grandchildren. It's caused me to feel sad and fearful. I've been very emotional about it. This is not normal for me to feel this way. I feel so bad because I can't even visit my children. I can't visit my grandkids. So there's a lot of fear out there like that. That question came from Darlene Lucas. I have a question from Andrea Lee, caregiver support. I'm caring for somebody and I'm falling apart. How do I, get help for myself when I'm trying to caregive for someone else? So those are hopefully some of the questions that you guys can answer, and I think have answered and given out information for them to seek your different agencies to get this type of help. But there's one question that comes from Rochelle Terry McMullen that's kind of different, that says, how do young people engage in this conversation? A lot of them seem to think that they are immune and refuse to follow the CDC guidelines. Young people don't think this is going to affect them, and they're not wearing masks, and people are asking those kind of questions. People are paranoid because they're going shopping and folks are not wearing masks, and it seems not to be any social distancing. You can't control what other people do. So how do you live when other people are not abiding by the social distancing rules and wearing masks? I'm just trying to get the questions that just come over and over again. And I'm trying to get them all out because I know our time is limited. But anyone kind of want to answer some of them?
I can address the young people, having a younger person in my home. I'm very direct, if you don't already know that. And I think one of the things I've shared, I make her pay attention to what's happening in the world. CDC, the updates, the deaths of young people, because they don't think they're going to die anytime soon. But it's a rule in my house. You have to practice social distancing, or when you can't come back. And I know that sounds a little bizarre, but there has to be a boundary made, a rule made for this. This isn't always, but for us to live and enjoy life later, this is something we got to do now. And so she respects what I'm saying, even though she's suffering. So the flip side, I have a conversation with her. How are you feeling? How are your friends? You know, what is it that we can do so that you can adjust? So asking the right questions, having the conversation, because of course they're not as resilient as we are, and we have to know that. So we have to create the boundaries and the rule as it relates to the younger people that lives with us. And two, if I'm paying all the bills, this is just what's gonna happen. And so we have to just be mindful.
Yeah.
Another thing is we have to understand that young people, they really depend a lot on their peers, and this isolation has been really difficult for them. And the other thing is, if we educate, a part of what we do in community health is educating them. And one of the important ways that we can get them to see it from a different perspective is to say, you're protecting me from the illness. If you yourself think that you're going to be okay, think about who you can affect. And would you want me to get this illness? If you go out and expose yourself and then bring it back to me or someone else within the family, your grandparent or whomever. So help them to understand their responsibility, not necessarily just to protect themselves, but to protect others around them.
Right. And I think young people that are adhering to the guidelines can put pressure on their other young people through social media. My son is a DJ. Of course, he learned how to DJ from the church, but we're not going to go there. He's a DJ, and he's been doing DJing with 200 and 300 people on the line. And he believes in masks, and he's actually raising money to give out masks. So people like that are using all the social media, I'm going to encourage him, have a DJ, a Zoom party with everybody with a mask on. So putting that kind of peer pressure. Secondly, not everybody has the availability of a mask. So for those that don't, we are going to be in the process of distributing masks, and I'm hoping that Bishop, you and other faith leaders and those of you here will help us distribute them. I know the city of Detroit is distributing them on buses, but they're probably the disposable ones. We're going to be distributing higher end washable masks so that no one has an excuse. Of course, you can put a bandana on too, but we're going to have masks so that no one has an excuse for not having one, not wearing one because they don't have one.
Sounds great. First Lady, we got time maybe for a couple quick ones.
Okay.
Quick questions, maybe.
We're
going to have to let it go.
They're still coming in. Genevieve Phillips wants to know, when it comes to grief, how do we cope and go through the process when we're not allowed to pay our last respect physically and cannot gather together as a family? And Marquita is kind of asking that same question. How do you encourage people from a distance when you can't even touch them and console them? Touching is so important. She said, I know people who, I've lost 3 people in 3 months, and I can't console and I can't touch. Touch is a sign of loving. And so how do we deal with this when we can't get with our families during a death and can't come together, we can't touch one another and console one another?
And
Sheffield?
Yes, and that is one of the most challenging things about grieving, is most people want to physically see or physically touch or be able to come together as family to encourage one another. And it's been almost impossible to do that. Even for those who are doing funeral services, they're limiting it sometimes to 10 people, or people can come through. So again, we have to find creative ways to memorialize our loved one. Here at Open Arms, we have done things like memorial quilts, where we've had families to come and learn through our telehealth and our activities how to create a memorial blanket and to do things that's going to help them to memorialize them in new and different ways. And again, this is all about embracing the new, but understanding that even those new rituals can bring some comfort and can help with the closure that they're trying and attempting to do as a process of their grief.
Okay. Dr. Wisdom, Cynthia Howe wants to know who qualifies for your program.
Depending on the infant mortality program or the food distribution program, I would contact, I'd probably, let me give you a number to call, and which I apologize is not at the bottom of the line, or go to our community health website, but 313-876-8408, and we can have a conversation with you in terms of, and share with you all the programs that are available and which ones you may qualify for.
Also, should we take precautions when we receive our mail packages and food deliveries?
I would say the same precautions that you take whenever you are shopping. Now, mind you, much of the viruses pass through the respiratory or through tear ducts, so keeping your hands away from your eyes and, coughing, sneezing, that's the primary form of transmission. Of course, the virus can live on surfaces, so you want to cleanse everything, disinfect as much as you can. Things that are delivered and surfaces and that sort of thing with standard disinfectants that you've been using. But yes, I would, but just wash things really well. The food, I wouldn't put disinfectant on food items, but I'd wash them really, really well. And then we also know if things sit for a while, that within 24 to 48 hours, the virus can't last on surfaces. So if things, items sit out, if they've sat for a few days, the likelihood of them being contaminated with virus are pretty low. And then the CDC's website also has up to cdc.gov, Centers for Disease Control.gov. They have up-to-date information, because one thing about this novel virus is we keep learning more about it. And so if it seems like in terms of healthcare, we're vacillating between, messages are confusing, it's because messages are evolving. So we on the community health website, as well as CDC's website, try to keep the latest source of truth for you so that you can know how to govern yourself.
Okay. Dr. Eason or Karen, are you all taking appointments? Because people want to know, Ayanna Turner wants to know, how do you handle grief support at this time when no one's taking appointments? Are you all taking appointments at this time, or are there options if they need help?
We are taking appointments here at Open Arms, and again, our number should be on the screen, the 313-369-5780. They can call for appointments. We are in the office, and we are open and taking appointments.
Dr. Eason?
Yes, we're open. I've actually worked every day since this pandemic started, and we are doing video appointments, but we're in the process of reintegrating. So we are beginning to, within the next couple of weeks, do some face-to-face with practicing all of the safety hazards. So yes, we're taking appointments.
Okay.
Well, I want to take this opportunity. I know we have so many questions, and so many of you have connected with us. You've engaged with us during this great Finding Peace Among the Pieces symposium, this holistic conversation about your health and mine, and about our community's health. And I've been so grateful to have you with us, and we thank God for you. And certainly you can continue to communicate with us. We'll try to get the answers back to you, and we can do that if you'll just let us know what your questions are. We'll do our very best to communicate right back to you, whether or not your question got on this symposium or not. I want to thank my panelists, Dr. Wisdom, Dr. Eason, and Dr. Sheffield. I want to thank you so, so very much for lending your time, your expertise to this very needed conversation for our community. And I want to also thank my co-host,
That's right.
First Lady Sheila Vann, who has always been right there and working with me with all of the crazy ideas I come up with. And so I want to thank her so much for lending her time this morning as well. So God bless each and every one of you. We hope you have a wonderful and productive day. Please stay safe and stay strong. Let's keep George Floyd, the memory of George Floyd and his family in our prayers as we lift them up. Let's pray for all of our people. Let's pray for America. We not only have a viral coronavirus. We have viral racism. We
Yeah.
have viral injustice that has been taking place in our country. And we're going to address that as well. And so thank you so much, each and every one of you. You mean so much to us. We love you. God bless you. And thank you for joining us today.
Absolutely. Thank you.
Thank you.
Be blessed, everyone.
Thank
Thank
you.
you.